I'm an RN in the DTC OR of the Royal Alec Hospital. That's our main OR.
What's a DTC OR?
It's Diagnostic Treatment Center. The patient comes in, they're off to sleep. My job is to make sure that no harm comes to that patient that shouldn't. So I have to make sure everything's padded, the patient's positioned properly. The equipment that we use internally is intact when it goes in and when it comes out, so nothing's left in. I'm in charge of making sure counts are correct, so nothing that shouldn't be in the patient is left in the patient, which I think is important.
Yeah.
So I come in the morning and I see what my staffing is. So I see there's usually myself and 2 other people in my room. And sometimes we have extra staff that are learning in that area, so I would take the lead. I manage the room, I'm in charge of teaching in the room. I coordinate patient care. So I see who my staff are. If I find that it's too weak for the day I would consult with my manager and have it changed so that to make it the optimist environment for the surgeon, for the patient.
Yeah.
Whatever, for me. I organize the scrubs, so I first of all meet with my girls and I'll say, well, who needs to learn what today? So learning is a big part of the component here in the OR, and we have a bunch of new staff. So then based on that and the skill level that I have in the room, I'll assign the scrubs. So we'll have, say, 3 cases in the room. It depends on whatever the surgeon books, right? It could be gallbladders, it could be bowel resections, it could be bariatric surgeries, it could be just lumps and bumps, stuff like that. And then we choose who's doing what, and that's the way we rotate our day. And like I mostly just circulate. There's a circulating scrub component to my day. I remember my first day as a student, I thought I was going to quit because they sent me to Dickinsfield, which was extended care. And I thought, if this is nursing, oh my gosh, this is the wrong decision. Because there's so many different aspects to it. Like there's geriatrics, there's gynae, there's peds, there's med units, there's surgery, there's different types of surgery. Yeah. But so I know my clinical instructor said, no, just live it out. This is your first rotation. There's your surgical and your med rotation and that, and she says, just give it time. You'll find a niche that you like. Which I really like surgery. The surgical units were good in my training. I enjoyed that. And then as my last 3 months, was it 3 months or maybe it was only a month, I got to pick an elective, and that's when I came to the OR and I had a preceptor, so it was my elective. And that's where I decided, yeah, this is where I want to be. So here I've been ever since. I think people think going into a medical profession, when you're doing like an OR, it's bloody and it's gross inside. But it really isn't. When you open it up, there's blood, but they stop that right away with cauterization. And once you get inside, everything's just neatly in their places. Like the liver's where it's supposed to be, the gallbladder's contained, the stomach's there. Do you know what I mean? It's just it's like textbook. It's like that when you open a patient up. That's what you see. You don't see like bowel contents. You don't see when you initially. Yeah. But if the patient, of course, is ruptured or whatever, then you do see that mess, or you do see pus if there's an infected appy or whatever. But you know, really, if the healthy body is not messy inside, it's nice and clean, and every organ has its place. I think it's a great profession if you're one that you're not going to get really rich in it. You have to find your work of helping people and doing the best job you can, and feeling that you're doing it to the best of your ability to sort of be rewarding enough. You know what I mean? Because it is really good. It is good to help people, because you think, yeah, no, you have this disease and you try and make their life better. Try to take care of your body as much as you can. Try to eat healthy. Try to exercise. So hopefully you avoid some of those nasty diseases out there that are causing everybody grief.